Hello everyone, I'm Dr. Jigyasha Shroff from Manipal Hospitals, and today we are going to talk about cardiac and vascular diseases. For that, we have in the house with us Dr. Sujoy Chatterjee.
Hello.
Consultant and Head of Department, Manipal Hospital, Broadway and Saltlake. Come, let's get to know the world of heart diseases and vascular diseases a little better with him. Hello, Doctor.
Hello.
Welcome.
Thank you.
And today, hopefully, our audience will get to know a little bit more about cardiac and vascular diseases.
Absolutely. It's my pleasure that you have welcomed me over here. And through this podcast, it will be our intention to make people aware of the basic cardiac diseases that are there and basic things that people need to do every day to prevent fatal heart disease.
Absolutely, absolutely. In fact, I was just having a talk with someone and I was telling them that cardiac and vascular diseases are so common, yet it's so complex, I've had to jot down so many points just to be able to talk to you about it. So I'm sure our audience has a lot to learn here.
I'll try my best to update them about the recent trends also about the various cardiac diseases.
Sure. So firstly, before we begin, I'd like to know, being a doctor is a tremendous feat in itself, and then you could have specialized in so many different things. But one, why did you choose to become a cardiothoracic and vascular surgeon? One. And secondly, how has your journey from AIIMS to Manipal Hospitals shaped you as a doctor? We'd love to know that.
Okay. So for this, I have to take you back to around 12 years from now, 12 or 13 years, 2012. After I joined the general surgery department in AIIMS, over there, after 6 months of training in general surgery, we were posted for specialized training in cardiovascular surgery, neurosurgery, and all these things. So, I remember the first day, my HOD in cardiothoracic surgery posted me in one of my professors, OT, Professor Milind OT. And I went there, and let me tell you that, heart surgery as such in general, when we are studying for general surgery, it's a completely new thing because it's completely different from general surgery. So I had not seen a beating heart before that, and neither did I know too much about heart diseases or heart surgery at that point of time. Just they told me, HOD told, go to that OT. I went to that OT.
Correct.
And, Milind sir welcomed me, come to my OT, asked me about where do I stay, my name and everything. Then I still remember, he told me, Acha Sujoy, ek magic dikhega. Haan sir. Then he did something on the heart, clamped the heart. Now I know what he did, but at that point of time, I didn't know what he did at that point of time. So he did something and the heart stopped. Okay. So like देखा magic कर दिया, heart बंद हो गया, patient जिंदा रहेगा. Then he did the procedure on the heart. Now I know that he did a valve replacement.
Yes.
And then slowly, after the surgery was over after around 1 hour or so, slowly he again did something and the heart came back. It started beating, the blood pressures were normal, everything was normal, and then slowly after some time the patient was shifted out. So at the end of the surgery, देखा हम लोग ऐसे डॉक्टर है जिसको हार्ट बंद कर सकता है और फिर भी पेशेंट को जिंदा रख सकता है.
Wow.
And then कल देख लेना पेशेंट एकदम मस्त चाय पिएगा. And that night I thought, wow, this is really fascinating. And then next morning I woke up and the first thing I got ready, went to the ICU and to see that patient, and I saw that patient was having tea.
Wow.
That was it. I saw that it impressed me so much.
Yes.
That whatever it is, I'll take up heart surgery as my specialty.
Correct.
So that was the first thing that stimulated me, told me that this is your specialty, you have to go for it. And very frankly, there was a lot of discouragement from various people, colleagues, because it's a very tough specialty, so to say. That if we take time to get established and so on and so forth, but मन बना लिया, वो देख लिया, हार्ट को बंद कर सकता है, फिर चला सकता है, हो गया काम, यही करना है.
Right.
So after that, after completing my general surgery training, I cracked the MCH entrance exam of AIIMS. Then I did my MCH from AIIMS.
Okay.
And after completing my AIIMS tenure, I came to Durgapur, where I was under the tutelage of two very famous cardiac surgeons. One is Dr. Sujoy Chatterjee and one Dr. Satyajit Bose at Mission Hospital, Durgapur. Now, Dr. Sujoy Chatterjee, what to say, he's one of the stalwart. I think he's the teacher of most of the cardiac surgeons in Eastern India.
Right.
So I was fortunate enough to get trained under him also. And then after 4.5 years of a stint in Mission Hospital, I thought it was time to take the plunge.
Yes.
And I joined. You'll have accepted me. So, and for the last 3 years, I am here, erstwhile Amri, and now Manipal Hospitals.
Correct.
So this is the whole journey that I had.
No, it's so wonderful, you know, it's such an exhilarating experience when you see, you know, a heart clamp stopped, a surgery performed and the heart starts beating. It is a miracle. I haven't witnessed this myself, but, you know, when I became a doctor, I never knew that this is how, you know, a valve replacement is done, where the heart is made to stop. And when I came to know this, I also felt that, you know, it was indeed magic, nothing short of magic. So
yeah, that's what Milind sir told me. I still remember that day on 2012. Sir told me, "देख सुजय, हम लोग मैजिक करते हैं, हार्ट बंद करते हैं, चला देते हैं, पेशेंट जिंदा रहता है."
Correct.
So you know, few words, you know, I will never be able to. It's just 13 years that he told me that, or 14 years maybe, and now I don't think I will ever forget that thing. You know. And that person, I still say the Milind sir, whenever I meet him, you are the person for whom I am taken up this specialty maybe.
Correct. You know, I had goosebumps when you, told us the entire experience that you had. Wonderful. Also, you know, people here, they've told me that you've performed about 3,000 major cardiac surgeries and 1,000 plus vascular and thoracic surgeries. Wow. So, I mean, this is such a, you know, huge number. But, you know, any particular case, any particular time, you know, which shaped the way you look at things or you take yourself forward now? Anything like that?
Yes. Now, let me tell you something. It's like anything. There are multiple incidents, similar incidents, okay, which, you know, keeps not only me, but my whole team, you know, to do this hard work, relentless work every day. So I narrate you the last of such incidents that happened. It was just 1 or 1.5 months back. We were scheduled to take a leave for 7 days, where elective surgeries would not have been done during the pujas, right?
Okay.
So there was a patient. He came to us, came to the emergency department with chest pain.
So just bothering you once, elective surgeries means planned surgeries.
Planned surgeries,
right,
yes.
Correct.
Planned surgeries, because during the pujas, the planned surgeries were off. For the emergency, there was a team for the emergency surgeries. So just before the pujas, that gentleman came to us and he had some chest pain and all. Angiography was done. It was critical coronary artery disease that was diagnosed, and the treatment for that was a bypass surgery. Now, whenever it happens that whenever a person talks about bypass surgery, a person, you know, thinks that that's the end of life and everything.
Yes.
So he was a little bit reluctant to get the procedure done. But what happened was, during his tenure of 2 or 3 days in the hospital, he complained of recurrent, very severe chest pain. So it was decided that, you know, we had a discussion with the relatives and the patient that, you see, during the pujas, sudden catastrophe, if it happens, it would be difficult to manage the whole team to get the surgery done. So it is better, since in the hospital, in spite of all the medicines, you are having chest pain, it would be advisable that you get the surgery done before the pujas. So ultimately he accepted that, and but the last day, that was a Friday, I remember, we planned his surgery, accommodating him extra. Because, you know, we have to
surgeries.
So that was that. Just on Thursday we left, we told him, hi, be ready for the things, and, you know, we had planned for a minimally invasive bypass surgery in that patient. So just after 1 hour I left, I was in the gym and I got a call from the ICU that his pressures are coming down, he's short of breath, oxygen levels are coming down, and all these things. So I asked them to get an ECG done, and ECG showed that, you know, the chest pain, which was just short of a heart attack in last 2 days, in spite of medicines, that, you know, just boomed into a full-blown heart attack. He was not able to maintain his saturation, his oxygen levels, pressures were coming down. We were lucky that the whole team, we have the team which have set up, stays close by in the hospital, you know, within 1 or 2 kilometers. We called up Dr. Verma, our anesthesia head, Dr. Ashutosh. They came along, I came along, and I brought a few members with my team. He was rushed to the OT. Relatives were told that this is the last option. We don't have any option for the minimally invasive thing now, because his condition is that we have to save his life. We performed a bypass surgery at around midnight and later midnight. And in 5 days' time, he was discharged on the last day of Durga Puja.
Okay,
Right.
wow.
Walking home. So he told me one thing, that I could see what happens just before a person dies at that point of time. That was what he told me. And this is the last incident, but there has been numerous such incidents in the life of a cardiac surgeon. The patient has an arrest in the cath lab, we do CPR, get him shifted. It multiple times it has happened, but this was like, I told that Durga Ma was coming and he did not want to take you along with him, with her.
Correct.
So that's why probably it was at such a time. I just left, I was nearby, the team was nearby, everyone, no one packed up for the puja. So we came, saved him, and after 1 month, he is a table tennis judge.
Okay.
So after 1 month, he was back judging table tennis tournaments.
Okay, that's lovely.
So now this is what keeps not only me but my whole team geared up for the next day.
Yes.
So, and that's it. Like, this is what the passion, you need to have the passion. And when we see those smiling faces,
Yes.
We get the petrol for the next day.
Wow.
That's what I
I
can
mean,
say.
very few people can boast of this kind of job satisfaction in today's day and age. I feel,
Absolutely.
Where, your job precedes everything and it brings you so much joy.
Yes. Those smiling faces, are the stimulus to go ahead every day.
Sure, they are wonderful. Also, when you just told us that, when the patient deteriorated, you were at the gym, and you got a call, etc. So, I wonder, with this kind of a packed schedule and, such a hectic life, how do you take a break from work every day to recharge so that you can come back and give your 100% the next day? How do you do that?
See, first let me tell you something. This specialty is demanding, definitely. But let me be a little bit candid over here. We have all watched a movie, Ye Jawani Hai Diwani.
Yeah, of course, multiple times.
Multiple times, most of us. So
Yes.
over there, Bunny and Naina, after that marriage, they go out for a Rajasthan trip.
Yeah.
So Bunny says कि ये hippie lifestyle, he promotes that hippie lifestyle. ये किया, Paris में गया, यहाँ पे गया, वहाँ पे गया.
Right.
And जो तुम लोग कैसे ऐसे रहते हो? And Nana told, ये life मैंने choose किया. And she jots down or says certain points which confirms what she has chosen. So ये life मैंने choose किया है. So that is it. Like if we do not have this passion and the blood rush every day,
Right.
probably I won't be able to rest. So it is demanding, no doubt about that. But for people like us who have chosen it, who love this, it is not demanding. Yeah, definitely, my daughter gets lesser time than other parents, but she's also getting adjusted to it, and and we make out time. It's not that maybe I don't go home at 6 o'clock, but maybe after 8 o'clock we go there, meet, go for malls and whatever it is,
Right.
like that. And we schedule our holidays in such a way
Right.
that all of us, me, my wife, my daughter, my parents, they are free so that we can catch up like that. So
Right.
that's how it is. So
Right.
they are also getting adjusted, and at the end of the day, वही है, ये life मैंने choose किया है.
Correct. So you exercise regularly.
I try to.
Wow,
try to.
that's very nice. And I think we're talking about cardiac health, vascular diseases here. I'm sure the audience also gets this point across that when you choose something, then you can beat all odds to do it.
Absolutely.
And you kind of never get tired, or it's happy tiredness, if I can say that.
That is what it is.
Yeah?
Happy tiredness.
Yeah.
You know what? The whole team, not only me, my anesthesia head, the nurses who are there, the assistants in the OPD, the managers, everyone, we have a set of very passionate people who loves their job.
Yes.
When that happens, we don't tend to calculate the time.
Yes.
Because we don't know how the time passes.
Correct.
And when we have structured the program in such a way, suppose today I have done 4 cases and we have started the podcast as 6. So, everything has been planned. Everyone knows their job. I know my job.
Yeah.
So that's how the things are not so much stressful.
Correct.
For a fighter pilot, that job may be stressful, but for him, that gives him the, kick and the pleasure.
Yes.
Like for us, that's the thing.
Yes, and I think you, with your passion and your love for the job that you do, and with the wonderful team you have, I think you all make it look very easy.
Yes.
Make it seem very easy.
Exactly.
Wonderful. Great. One thing I want to, move on, and so, with general population, people who are watching this right now, heart diseases, cardiac diseases mean just that, heart diseases. But we know there are many kinds of heart diseases and vascular diseases. So can you just, run us through them, and, then probably, we'd like to know the various risk factors for these diseases.
Yeah, Dr. Jigyasha, this is a very important question because, we see a lot of patients and they tend to put all the heart diseases in the same bracket.
Yes.
Heart rog.
Yes.
Heart ka bimari.
Yes.
But, heart has around, if you see the heart as a whole structure, this has subparts. And every part of the heart can be diseased and can lead to certain symptoms and require different treatments. So yes, I would take this opportunity to make people aware of the basic kinds of heart diseases, right? So the first thing which, in today's world, the most common and the most severe heart disease is the coronary artery disease. So what is that? Coronary arteries are arteries which supply the heart, give blood to the heart, right? So coronary artery disease means due to formation or due to deposition of lipids, fats, cholesterols, and later calcium on the walls of the coronary arteries, the lumen narrows down. Okay, so it should be like this. It narrows down like this because of the deposition of fats and all these things.
All right.
So the blood supply to the heart is jeopardized.
Right.
Okay, and this is the cause of heart attack. Okay. So coronary artery disease. Now I just take it a little bit further. This coronary artery disease is a disease of the blood vessels, of the arteries, right? It's a disease which the condition which leads to a coronary artery disease is atherosclerosis. It's a disease where there is a deposition of fats, cholesterol, and calcium on the walls of the blood vessels, thus narrowing the lumen. Now, when this blockage is in the heart blood vessels, it is coronary artery disease and causes certain cardiac symptoms. Now, the same deposition can be in blood vessels supplying the brain.
All right.
Then it causes stroke. That same deposition can be in arteries supplying the limbs or the legs. Then it causes peripheral vascular diseases. It can also be deposited in the blood vessels supplying the kidneys, renal arterial diseases. Okay, so this coronary artery disease is basically a systemic disease, what we say. It affects all the arteries of the body. When it affects the heart, it causes cardiac symptoms. When it affects the brain, it causes neurological symptoms. When it affects the limbs, it causes symptoms like leg pain and all. So, we have come across patients whom I had operated on a bypass surgery, and later I had operated on a peripheral bypass surgery.
I get it.
Or a person who had undergone stenting for heart needs a bypass surgery for the leg. Or you will often find also that patients who are taking medicines for stroke, medicines for heart diseases, certain medicines are similar.
Yes.
We give statins, we give antiplatelets for stroke because the disease is not on the heart or brain. This is on the blood supply.
I get it.
Blood vessels of the heart.
The cause of the disease in various parts of the body is similar.
Same. It's atherosclerosis.
I get it.
So the risk factor for that, the medicines are quite similar. Yes, there are definite medicines for, heart conditions for that, brain conditions for that. But, the main preventive medicines, I can say, are same. Okay. So that is the first category, which is coronary artery disease. And this will answer another part of your question is other vascular diseases are also has the same origin.
All right.
Atherosclerosis. So that goes one category. Now I just tell you, for this, the primary treatment is either stenting or bypass surgery.
All right.
Okay.
Yes.
Now we'll come to our details a little bit later. The second category is electrical heart disease. So we have an electrical circuit in the heart. There is a electrical pulse generator, which is called the sinoatrial rod, and there's a network of wires, you can say, to very colloquially, inside the heart, which transmit that impulse right through the last tip of the heart.
Okay.
So whenever there are any blockages in these circuits, the electrical circuit, that leads to complete heart block, CHB, and requires pacemaker or specialized pacemaker like left bundle branch block pacing, left bundle branch placing, and all these things. So that is a second category. Electrical heart disease, for which the major treatment is medicines is always there, or pacemakers and all these things.
Yes.
Okay, so third category is valvular heart disease. Okay, so valvular heart disease, to ensure an unidirectional blood flow inside the heart, there are a set of valves. There are 4 valves, 2 on the right side, 2 on the left side.
Right.
So the left-sided valves are affected by various conditions. So the mitral valve, aortic valve, they can get stenosed, where they dry up, the opening becomes small, or they can get regurgitated when they leak.
Okay.
They have a various symptoms, various way of judging. So then the third category is, you can say, is valvular heart disease.
Okay.
So that requires valve replacement or interventions on the valve to address.
I get it.
Another category of cardiovascular disease is the aortic disease. Aorta is the main artery that supplies blood to the whole body. Okay. So, aortic disease is what the aorta becomes, dilated like a balloon, and it can rupture. So that is another category of disease, aortic disease.
Okay.
So primarily, what I told you till now, the 4 or 5 categories, 4 categories, they are broadly classified as acquired heart diseases. Okay, because they are acquired in the lifetime
over
of a
the
person.
lifetime.
Yes.
Okay.
The another category, broad category, is congenital heart disease.
Okay.
Babies are born with certain heart conditions. That can be just a hole in the heart, or that can be major problems like one side of the heart, right or left side of the heart, has not matured also.
Okay.
Yes. So there are single ventricle physiology, and we can discuss it in details later.
Yes.
But they are a broad category which are known as congenital heart disease.
Okay.
So to sum up, there are 2 broad categories: acquired, congenital. Acquired has coronary artery disease, electrical, valvular heart disease, aortic disease, and another major types. And another one on this side is congenital heart disease, where a child is born or a baby is born with certain conditions that can get manifested just after birth and requires an intervention, or that can get manifested after 20 or 30 years and an intervention is required at that point.
I get it. Okay. Very interesting, but very complex.
Very.
So, when you were talking about coronary artery diseases, the one thing, please correct me if I'm wrong, I got is like, we can assume that maybe these arteries are like tubes running hard water running through it, and over time some deposits are formed inside those tubes.
Exactly.
Pipes.
Yes.
And then it blocks the flow of, say, hard water, here blood.
Absolutely.
And it causes coronary artery disease, right? And
so just to interrupt you, the
please.
analogy what I tell all my patients is, suppose you have a house, you have a water connection, you have an electrical connection.
Yes.
Both are required, for the house to function properly, right? So in old houses, I stay in a very old part of Kolkata where the pipes are very old, 50 years, 60 years. So often we find that the water supply get reduced because of deposition of minerals in the pipes and all. So that is what you can draw the analogy as coronary artery disease.
Yes.
So certain times the pipes can be cleaned and the things can be settled, or you need to change the pipe to get a proper water supply.
Right. I think now this is very clear. Yeah.
There is an electrical supply to your house. The wires can get cut. Short circuit happens. Something happens.
Yeah.
So interruption of power supply. You need a power generator.
Right. So
or you need to change the wire.
Right.
So that's what the pacemaker does.
The pacemaker. So can we say that the pacemaker is like the switch of the heart?
Pacemaker is somewhat like the transformer, or to say It generates the electrical impulses,
Right.
and I told you there are a set of wires inside the heart,
Right.
which gets the electric
To all of
inside
the heart.
and into your room and everywhere.
Right.
So there can be blockage at the generation center and as well as at the supply center. And depending on where the blockage is, generation or supply, we have various kinds of pacemakers that can be implanted.
The human body is a wonder, isn't it?
Yes.
Electricity, fluid, everything over there. And the valves, are they like doors? Are they like,
exactly.
doors?
In the house, valves are like doors.
Between...
You have this door, don't have this door, it's leaky.
Right.
Anyone can come in. You have this door, you prevent some people from coming in.
Right.
Absolutely.
Yeah, okay.
So you draw the heart as a house, three things, three main diseases.
Okay. And the aorta, like you said, it's the
it's the main pipe coming
water
out.
supply.
The pipe bursts and the water supply of the house goes.
Correct. So, very interesting.
जड़ पे ही problem है, भीते ही problem है बांगाली के. So that can be a congenital heart disease. You don't put the foundation right.
Right.
The whole house is shaking, so that is congenital heart disease.
Congenital heart disease. Right. That I think is another topic that you have to delve into someday maybe. All right. And now that we know that these are the diseases, what would you say? If I'd ask you, you have a strong expertise in congenital heart surgeries. So, what changes have you observed in the diagnosis and the management of these diseases over the years of your practice?
See, the first thing that I think which has evolved recently, maybe around...
And particularly in the management of congenital heart diseases in children, I mean.
Yes. So, see, the management involves both diagnosis and treatment. In medical terms, management, more diagnosis. Now, with the coming in of the fetal echocardiography, that is a revolution, I think. Why? Because, when the child or when the fetus develops, there's the first trimester when the organogenesis is complete. And I think till 20 weeks or so, there is legally that, it can be aborted if there is any problem. So around 18 to 20 weeks, there are specialized people who does an echocardiography of the fetus. Yes, the fetal echocardiography. Basically, first there is an anomaly scan and followed by a echocardiography if there is any doubt. So that I think has revolutionized the diagnosis of congenital heart conditions, because one thing, you see, a child born with a very severe heart condition is a trauma for the whole family. So often I had a few instances, few of my friends or distant friends, they've asked me, they had a very critical heart condition in the fetus, and he was advised by everyone to abort it and try it for the next time. So the mother going through a trauma of giving birth to a invalid child or something like that is being taken care of. There are certain conditions which can be managed very well. Now, if that is diagnosed, then the mother along with the child can be transported to a center where the holistic management of mother as well as the heart condition of the child is there.
Wonderful.
See, we have done various times and multiple times in AIIMS. It was the EPIC center. So there we had the provisions of managing the mother very well, as well as all kinds of cardiac surgeries were done. So we had multiple such incidences where the mother was directly transported from various parts of the country, and the delivery was done over there, where the cardiac surgeon or the pediatric cardiologists were ready. As soon as the baby comes out, they were done certain procedures to keep him or her alive for that time, till the time another surgery can be done. So post-birth, the surgery has evolved, will evolve, all these things are there, but that fetal echocardiography and certain fetal interventions has revolutionized. One way it has prevented the trauma of the parents of giving birth to that kind of a child, and if there is a correctable cause, the thing can be started right from birth.
Absolutely.
For me, I think that is the most significant achievement in terms of management of congenital heart disease.
Correct.
Yes, after birth, there are various kinds of surgeries are done, various interventions are
Yes.
done. All these things, okay. But to know before and take a stand,
Yes.
I think is the best part for me.
Yes, no, I totally agree. The anomaly scan has indeed revolutionized the whole process, where we get to know things
Absolutely.
and we can do something about things that we can control.
And we can't control, so we have to accept certain thing and try out next time.
Correct. So this is about congenital diseases where you're born with it, or what would your advice be in case of, like you were saying, diseases that are acquired during the lifetime? What would you say are things that people can do to prevent experiencing these diseases? Lifestyle changes and other changes that they can make so that
Okay, so let me describe it a little bit elaborately. So if you try to say the prevention of an acquired heart disease, now we are mostly concerned now with the coronary artery disease, because all the risk factors you see, tel nahi khana hai, ye oil khana hai, gym mein jana hai, all these are primarily to prevent coronary artery disease, or the metabolic factors which lead to coronary artery diseases. Or if you try to prevent coronary artery disease, you automatically prevent the risk of stroke. You automatically, because it's a vascular disease that you are treating or
like
trying to prevent.
Yes.
So now for that, what I say is it starts from the childhood. I always say, I try to apply this to my daughter also. Certain childhood habits. Instead of watching the football match or certain things on the phone, it's better they go out and play. They have an active lifestyle. If it is just 500 meters from house, if the school is, or the tuition class, it's better they walk than they go by car. So the basic level of activity should be a little bit higher. Okay. Food habits, definitely. What happens is nowadays everything is from outside: cakes, pastries, patties, all the things. So let that be there, because a child needs that. But at the same time, fruits with roughage, normal rice, roti, that also should be a part of the diet. Because that lifestyle, when it starts from childhood, that will carry on for the next 50 years of his or her life. Thirdly is stress management. I would say, it is very important for everyone who has children, or right from there till now, we teach, or we have a mechanism to manage our stress. Anxiety, because exams तो होता रहेगा सबका लाइफ में, and exams are required also. एक बार एग्जाम में खराब भी हो सकता है, एक बार अच्छा भी हो सकता है. But that's not the end of life. There may be a girl who can dump a 18-year-old guy, but there are other girls who can take him up, right? So the way you manage your stress, the way you manage the daily stresses of life, that should also start from childhood. Okay, and the parents should always, instigate or prepare the child about the side effects of addiction. Because people often consider smoking, drinking as a very hip thing, right? And they fall into peer pressure.
It's become a accepting factor in societal circles these days.
Exactly. And now what happens, Dr. Jigyasha, is like whenever a child starts on this thing, he or she doesn't know where to stop. Maybe an amount in moderation is good, but how will a child know that? So I think this, making them aware from childhood, will go a long way in preventing certain things in future. Okay. So next, if you say mid-adulthood or so, what I would say is the major causes of these problems is hypertension, diabetes, hypercholesterolemia, addiction, and the lifestyle problems, which includes a sedentary lifestyle as well as lack of exercise. And stress management. So getting from we often get patients who are in their 20s of very high BP, of diabetes, and often they don't know that they have the condition.
In their 20s?
Yes. They don't know, because they may be undergoing a surgery, or they may have some fever. Suddenly it is found that they have certain conditions. So, getting certain checkups,
Okay.
regular BP checkup, blood sugar checkup, lipid profile checkup, going into the habit of going to gym or some form of physical activity. I'm not saying, I'm not, professing that going to gym is good, or yoga is good or whatever, but some form of
Physical
activity at least 3 to 4 times a day,
Yes.
walking maybe,
Yes.
so such things should be done regularly.
Right. And in fact, in fact, I've been reading that, like say I go and exercise an hour a day, and then the whole day I spend sitting on a chair. They're now saying that, getting up every, say, 30 minutes for an errand, that is a lot more healthier than a whole hour or 2 hours of exercise in the gym in a day.
See, what
Need to be active
exactly,
through the day.
Exactly.
Yeah?
Now you see what there has to be a balance, right?
Correct.
So you may, or suppose we are in a profession, often our surgery spans 3 to 4, 5 hours. So often going around, running short errands may not be an option. But the holistic thing, some exercise, avoiding going up, walking around certain times of the day, taking the stairs, this habit of being active.
Yes.
Rather, the habit of being active is very important.
Yes, I think especially in this day and age when
Absolutely.
everything around us is designed to make us inactive. And
the habit of being active, if you start going to gym, you will get that habit of being active. If you start walking a lot, you get that habit of being active. So that is what I think is very good. That this sums up. You have to have the habit of being active.
Right.
So this is the second category. Third category is there are 5 or 6 basic symptoms of heart disease.
Okay.
Right. So if I'm telling you the symptoms, if such symptoms happen, it is always advisable to go to a specialist and get themselves checked up.
All right.
So that if something is there, it can be detected at a stage where major damage has not been done.
So early symptoms.
Early symptoms.
Okay. Right.
So symptom identification and proper diagnosis.
Yes, that I think the audience would really love to know, so please, if you could tell us more.
Okay,
please.
so there are 5 or 6 major cardiac symptoms, right? And whenever we are trying to concentrate on the symptoms, we have to keep in mind our perspective in which that symptom is happening. So I tell you, one of the most common is shortness of breath, right? Someone is short of breath. Now here what I find is often a person who is very sedentary, and he starts climbing. He has built a new house and he starts climbing. It is 2-story house and he has to climb up 2 stairs, 2 stories, right? And he's short of breath. That may not be a cardiac symptom.
Right. Yeah,
So,
a lot of times these people come and saying,
we find after surgery has been done, everything is fine, and they say, I'm still short of breath. When you are short of breath, when I start run to catch a bus, I'm short of breath. So that is obvious.
So
you had a surgery done, 2 months, you were not very active, and then the next, on the 61st day, you run to catch a bus, you will definitely be short of breath.
You have to put it in context.
So that is one thing. Second is palpitation, right? Now again, you did not sleep, you have a you have a critical patient to operate, something, your heart starts beating fast.
You have an examination, you have a court case,
everything, and you have your heart is running fast. Now that may not be a cardiac symptom, that's simply anxiety, right? So what I just took a class of young undergraduate students in Arjigar few days back. So over there I told there is a guy sitting and a girl comes and sits next to him, and he has some interest on that girl, his heart starts racing. So that's not a heart disease. That's not a heart disease, right?
That's a good one to have.
That's a good one to have, right?
Yeah.
So that is again, you have to have the perspective in mind. Then there is syncope, what we say. Sudden blackout. A person is walking, blackout, and then the blackout, it comes back to normal after around 20 seconds or so, and absolutely normal.
All right.
That's called syncope.
Correct.
There are non-cardiac causes of syncope also,
Mhm.
but there are 2 or 3 very major cardiac conditions which can lead to syncope.
Okay.
Okay, so that's for us to decide.
Okay.
And the most important, chest pain. I told you the major cardiac disease, coronary artery disease, and the
Right.
major symptom of a coronary artery disease is a chest pain.
Right.
So what happens is, typical description of a chest pain due to heart is it's a chest tightness.
Chest
It's not a
tightness.
pain as such.
Uh-huh.
It's a tightness at the center of the chest, going to the jaws and to the left hand.
All right. Yes.
When it comes,
Hmm.
it normally comes at the feet of any exertion. Okay?
Okay.
So a person is running,
Hmm.
there is a chest pain, sits down, settles down.
Correct.
Okay? So that is one. The main problem with chest pain that happens is,
Hmm.
it is often confused with a pain due to gas.
Oh yes. Yes.
गैसेर व्यथा.
Absolutely. हाँ. Gas.
खाने के बाद दर्द होता था, गैस सोच लिया,
हाँ.
जेलुसिल खाया, ठीक हो गया.
Yes.
This is a very common saying that a patient tells us even just before a bypass. मैं तो कुछ था ही नहीं, वो गैस का दर्द होता था,
हाँ.
बुला के एंजियो कर लिया, अब देखा गया कि ब्लॉकेज है, बाईपास सर्जरी
हाँ.
करने बोल दिया.
Yes.
So this is a very common thing.
Sure.
Now I tell you one thing. See, why this happens? Why this chest pain happens? This chest pain happens whenever there is a demand-supply mismatch of the heart. The demand of the blood of heart increases. The supply is restricted due to blockages.
Okay. So the heart is calling out for blood.
Calling
in a way?
out for blood, and it's not getting blood because you have your blood supply to your houses, water supply to your houses decreased.
Yes.
2 or 3 people are there, they are managing.
Yes.
Suddenly there's a invitation and 10 people comes in.
Ah.
There's a water crisis. So similar thing happens inside the heart.
Right. All the hue and cry.
Hue and cry happens.
I get it.
They take rest. वो सब चला जाता है, फिर ठीक हो जाता है. बोलो तो. So that chest pain. Now, why it comes in after a meal? Because when we are exerting, the blood has to pump more blood to the muscles.
Okay.
When we are eating, blood has to pump more blood to the intestines.
Oh, all right. Okay.
Because that digestion involves a lot of blood usage.
Right.
Requirement of blood increases. But again, the same thing. The heart is not getting blood to pump blood.
Right. It's
Right.
gone there.
Gone there.
Right.
नहीं मिल रहा है, दर्द हो रहा है. And because there is a relationship with the food, people confuse that with gas pain.
Gas.
Now they take a Gelusil. Digestion complete. Exertion वही relative चला गया,
Right.
फिर से 3 आदमी
Subside.
सेटल हो गया, पेन सेटल हो गया. तो जेलुसिल जस्ट खाया, वो ऐसे ही 15 मिनट बाद सेटल होना था,
Oh, God.
हो गया.
I'm sure so many of the audience who are probably seeing this today must be
Exactly.
relating
And
to this.
such patients
Yeah.
end up having a heart attack. The pain doesn't subside in spite of anything, and they come in, there's a major heart.
They had the warning signs all through.
Exactly.
But,
So whenever such things are happening, they may be just after food. Another thing which I say is this is metabolic exertion. Another is mental exertion.
Okay.
Someone is very stressed. The heart has to pump blood to the brain. Again, it's pumping.
Yes. Yes.
Demand supply mismatch.
All right.
Again, they may have a chest pain.
So that's why we say the stress is such a big factor.
Stress is
with
such a
heart
big factor.
diseases.
You often find in Bengali movies, लड़की भाग गया,
हाँ.
पिताजी
हाँ.
chest pack करके बैठ
Correct.
गया, heart attack हो गया.
हाँ.
Same thing.
एकदम. Okay.
Same thing. These are all precipitating factors.
Yes.
And all these things lead to a problem. So whenever they are basic, दर्द कम नहीं हो रहा है, उसके पहले जाके
Correct. And it's better to assume that any pain in the chest is probably related to the heart than bloating or gas.
Absolutely, because
Rule it out.
there are 10-20 causes. In MBBS times, you have also written causes of chest pain.
Yes.
And we write pruritic chest pain, this.
Yes.
But the most severe one, which can make a difference between life and death, is the heart pain.
Always.
So whenever we all become happy when the heart is right,
Yes.
but it needs to be confirmed that the heart is right.
It needs to be confirmed.
Yeah.
Alright.
So that is the thing. To sum up, you start from childhood,
Yes.
then you see the risk factors are there or not, then don't neglect the early signs. And
Correct.
if something is detected, get it treated before there is a severe condition.
Right. So what I see here is a clear domino effect. If you start from childhood, you do things right, adulthood, keep the risk factors probably in control, go for checkups, and when the warning signs knock, you take help, it can have a positive domino effect. The other way, it can, have a negative effect. Very interesting. I'm sure, a lot of people watching this, are really understanding a lot, and they have more tools.
This awareness is very essential.
Yes, awareness. They have more tools now. They'll know better, I believe. Great. Thank you so much for this. But I want to know one thing here, that, we're seeing this very disturbing trend of, there's a rising trend of heart diseases, vascular diseases in very, very young patients. Like you were also mentioning, 20-year-olds being operated. What would you say about that? I mean, what are the contributing factors? What is leading us there?
See, madam, the thing is what I told you one thing.
Yeah.
Right from childhood, we are not probably taking care of the risk factors.
Yes.
Right. First thing we have to know, there are certain, whenever we are talking of risk factors for heart diseases, and everything is, the congenital heart diseases, certain amount of incidences were there before also, they are presently also.
Yes.
Okay,
Yes.
just that the identification of such conditions have increased because of the better tests. But the major shift has been towards the incidence of coronary artery.
Yes, and it's very disturbing.
Very disturbing, because all the risk factor management, everything is, to prevent the coronary artery disease.
Yes.
Because some amount of valvular heart diseases, everything was there, right? So, the reason is, number one is, the lifestyle that has changed. Okay. Previously, when my father was there, during his time, the khala money, they have to go out. Okay.
Yes.
At their times,
that was
game was something outside.
Yes.
Right?
Yeah.
So just what you told, that even if you don't get a time to exercise, you just get up and do something.
Yes.
You just play, you just climb your stairs.
Yeah, run
now
errands.
Most of the housing has lifts.
Yes.
Okay. Most of the good households have cars, or you get a Rapido or something.
Yes.
The car is available.
Yeah.
Everything is available.
Yes.
Right?
Yeah.
So the level of activity has come down. Stress level has gone up immensely. We are from a generation where we had to manage stress. Phone nahi tha, WhatsApp nahi tha,
Correct.
landline, call karo, otherwise it's
And there
not
were no instant fixes to anything.
Exactly.
No 10-minute delivery.
no 10-minute delivery. So
Yeah.
it's not bad. But that has reduced the level of stress. Suppose I want to call you and I don't get you, you are busy and you don't pick up the phone for something. My stress, I have to tell her that, solve this problem with the patient and all.
Yes. Yeah.
Previously I knew that I have to wait for 10 minutes to connect with Dr. Jigyasha,
Yes.
right?
Absolutely.
So such things, the food, there was primarily home cooked food.
Yeah.
Restaurants, people can, keep track in their diary that those are the days we had gone for restaurants.
Yes, and there were only that many restaurants I remember
Exactly.
growing up. We knew the names, and today
Exactly.
there's one popping up every other day.
And you had craving from ice creams at midnight.
Yes.
It was not possible. So
Not
the cravings
possible.
were not there at that point of time.
True.
For my daughter, if she has a craving for ice cream at 12 o'clock, there's a Swiggy boy or a Blinkit boy. They're good. I'm not trying to, but they can deliver it.
Yes.
So, the patience to wait for something has gone down.
Yes.
Right. And all these things have led to a tremendous, I think, a stress level, increased stress level among work stress were always there. It will be there and it should be there. But all these things have added to the stress level so much. That's why I told you the managing stress from a very young age is very essential.
True.
For future, not only for heart disease, for various aspects of life.
Right.
So all these things have led to the occurrence. Secondly, what I would say is maybe 10 years or 15 years or 20 years down the line, they were there. Now there is increased detection.
Yes.
And because there is increased, suppose 20-30 years from now, there were instances of sudden death in gym.
Yes.
Maybe. How come if there is a condition? There have been many players right from last 50 years. If you go by the history, they have died on field.
Young
Died on field.
Yes.
But nowadays, because it is reported, number one, and there were diseases that were there but not diagnosed, and ultimately a person dies at 40 years or so. So now there are options to get themselves diagnosed and treated.
True, I think because of social media and so much reporting, we get to know everything.
Exactly. And two things that has happened is social media has increased the awareness.
Yes.
There are good sides to it.
Yes, absolutely.
After this podcast, if someone has a chest pain, they will definitely try to get it evaluated wherever it is.
Correct.
And if they come to know, maybe it was just gas which they were neglecting as a chest pain due to gas, but it was a heart condition.
Absolutely.
And they get treated.
Yeah, that's going to be because of social media again.
I tell you, not everything is bad. This has happened, and people are getting treated, and the longevity, lifestyle, life expectancy has significantly increased.
Correct. Yeah, that's also true. That's true.
Has significantly increased.
Yes.
So, not everything is bad. Maybe true incidence has also increased. And secondly, it is the level of detection that has been there and reporting.
I get it.
That can also contribute to the increased number that we see at present.
I get it. So, here one thing, I feel like they say too much of anything is bad. I think it's a case of that. Too much of, I would say instant gratification here. It was all these, facilities that we have today. I think they were all designed with keeping in mind that, they'd make life easier for us and give us more time into doing things which are better for us, more productive and healthier. But I think somewhere, we have to maintain the balance, because that off balance is...
Madam, I think you have just spot on. Balance is the word. Balance is the word. It's everywhere. It's doing cardiac surgery and giving time to the people at home. Doing your job, managing the hospital and giving time. Everywhere there needs to be a balance.
Right.
There are various benefits of getting a thing within 10 minutes, but there are various disadvantages of getting the thing in 10 minutes. So that balance is very important.
Correct. I think when someone like you, with such a busy schedule and such a hectic life, I would say, which of course you don't feel it's hectic, but such a hectic life, you can maintain that balance. I think all of us can aspire to do. It's just about trying, right? I think we can all, try to do that too.
Absolutely.
Yes. So, this is, they asked me to ask you about complex aortic conditions, like, sounds so complex in itself. So, these complex aortic conditions like aneurysms and dissections, they're becoming very common apparently these days. So, what are the challenges in, taking care of these cases in the country? They're rising. So, how do you go about that?
Now, definitely the aortic. First of all, aorta is the main artery of the heart.
Yes, sorry, I'll cut you once, but firstly, I'd like to understand what this is.
Exactly. So, let me tell you. This is not very common. Coronary artery disease, heart blocks. People keep hearing.
Yes.
But aortic diseases. It is the main artery of the heart. The heart pumps into the aorta, and then there are various branches supplying it to the whole body.
Okay.
Yes. So now with Kolkata perspective, I can tell you Tala tank. Tala tank is the main.
I've heard about it. Yes.
It's the main blood supply. At one point of time, it was the main water supply to the city.
Yes,
right?
I've heard about it.
During the British time. So there's a whole tank, big tank. A pipe comes out and it supplies the whole city.
Correct.
So the pipe which comes out of the Tala tank is actually the aorta.
Okay.
Right. So from the heart, the main artery comes out, and then by various branches and sub branches, it supplies blood to the whole body.
Correct.
Right.
Correct.
So the first part of the aorta, or the main aorta that is there, the main pipe that has certain conditions when it dilates.
Right.
Okay.
Right.
So what happens when a balloon keeps dilating? At one point of time, it just blows off.
Yes.
So that is the condition. This is the primary condition when the aorta keeps dilating, and there are certain conditions in which the aorta dilate, and there are certain symptoms due to which the aorta dilate, which comes in a person after the aorta dilates. Symptoms, right?
Okay.
So that is the thing, that if it dilates, the main problem that can happen is dilates to a particular extent, and then it can just
Burst.
blow up.
Okay, just like a balloon.
Balloon.
Okay.
Exactly.
Okay.
So, and when it blows, once the main artery blows off, when the Tala tank pipe blows off,
Yes.
the whole city
It's
water
cut off.
supply cut off.
Okay.
So that is the thing. And without blood, a person doesn't survive.
Correct.
So this is what aorta is. So the main challenge is it is a complex condition, right? So what I feel in today's world, in today's India, the main challenge is, number one is lack of infrastructure
Okay.
and trained manpower, and second is cost.
Okay.
Okay. Now to diagnose, suppose what is required to diagnose a proper aortic condition, we need a very high quality CT scan, and that scan has to be read by a well-trained radiologist.
All right.
Okay, a vascular radiologist who needs to give us the information of what is there and how we will treat the condition.
Okay.
So that is the first thing. CT scan is a very common machine.
Yes.
Every
It's
nooks and
everywhere.
corners of the city, suburbs, everywhere you get a CT
Yes.
scan, right?
Yes.
But all CT scan, I think out of all the CT scan, when thousands and thousands of CT scan
Absolutely,
machines are
it's
there,
everywhere. Yeah.
not more than 1 or 2% of the CT scans that are there can diagnose an aortic condition.
Okay, you're saying the CT scanning
Machine and the
quality-
person interpreting that.
the radiologist, the
Radiologist.
vascular radiologist.
Exactly. So, we find the CT Korean nichi. Or CT, we advise a CT, আমরা ওখানে গিয়ে করিয়ে নেব।
একদম
This in
হ্যাঁ,
Bengal
হ্যাঁ, যেটা
में
বলে,
होता है,
হ্যাঁ।
नहीं होगा। Either the CT scan, it has to be a very good CT scan machine, and in spite of that, a person who is interpreting the CT scan has to be trained in diagnosing aortic.
The man behind the machine.
Man behind the machine. The first thing. Second thing, often that dissection is a partial rupture of the aorta, internal rupture of the aorta, right?
Okay.
Aorta ruptures, but it doesn't come out. Internally it ruptures. So that is a super emergency condition.
Yes, I'm
Okay.
sure, yeah.
So when an aortic dissection patients come to our emergency, at that point when we suspect, we need to get a proper gated CT scan done, diagnose the condition, and within 2 to 3 hours that patient has to be shifted to OT.
So everything has to be on point and immediately.
Immediate. Now dissection is not such a common disease that it will keep coming 5 or 10 every day.
Yes.
It can come one every month or so.
Yes.
But we have to have the infrastructure ready. Whenever a person who is suspected of having an aortic dissection comes to our emergency,
Yes.
1, 2, 3, 4, 5, 6 things are done and the patient gets shifted.
Right. So which means you can only get treated at tertiary care world-class hospital for something like
and
this.
one thing is a referral network, because there can be an idea that the patient may have aortic dissection or may have an aortic condition
Right.
at peripheral centers also.
Yes.
But there has to be a complete network that they come on time without neglecting to a specialized centers where this kind of machine is done there, where the person behind the machine is good and the person in the team, I won't say the person, the team in the OT is well equipped to manage such conditions.
Correct. So escalated properly through the network and then lands in the right place with the right technology, right manpower, right team,
I can tell you, we had just giving just a short story.
Yeah, please.
At Manipal Broadway, we had a patient who had come with weakness of one of the hands or limbs, right?
Okay.
So initially it was thought to be a stroke, CVA, because of the weakness.
Sure.
But while evaluating the patient, there was discrepancies on pulses on the various limbs.
Okay, the pulse. All right. Yeah.
So suspecting that, initially everyone was suspecting stroke. Because of the discrepancy of pulses, a CT scan of the aorta was done. And we have every infrastructure over there in Broadway. Dr. Jain is a fantastic radiologist sitting behind the machine.
Wonderful.
Yes.
Yeah.
So, and he was diagnosed to have a aortic dissection. So we took him up.
Wow.
He is still a football coach. His academy is in Rajarhat.
Okay.
Okay, so we took him up to the OT diagnosis, told that it, and another thing is often the treatment of aortic conditions is prohibitive because of the cost.
Yes.
So they were well off.
Uh-huh.
They understood the thing and they were ready to take all the measures. We took him up. He's fine, and after 6 months or so, he's back in the field. We had done another CT scan, which showed that all the dissection flaps, again the blood supply to the whole body has been normal. All the blockages that was there due to dissection, blood supply in the legs, and everything is the weakness which was there is all off within 6 months, and he's back in the field.
What was this gentleman's age like?
He was 62, 63.
Okay.
In the 60s.
Yeah, and
in the
he's
60s.
back.
It's around. He always comes for follow up every year. It's
Huh.
around 3 years that he has been operated,
Okay.
and he's doing fine.
Wow.
And we had done a check CT scan to see everything has fallen in place and the thing is fine.
Okay.
So this is, I think, the infrastructure, manpower, cost.
Infrastructure, manpower, and cost.
These are the three things which is majorly prohibitive of diagnosing and treating an aortic condition.
True. And now that we have it, at our hospital, I
Yes.
hope more people can make use of it.
Yes, I want to tell
in
you
time.
that in such a rare condition, in last 3 months we have operated on 9 aortic cases, and all have been discharged in 4 or 5 days and doing very well.
That's a high number, isn't
Yes,
it?
compared to the rare conditions, the disease being so rare,
Yeah.
it's a very handsome number that we do.
Yes, because during our MBBS years and internship, we rarely got to see something like
Yes.
this. So it sounds like a good number. All the very
And
best
another
to your
thing is
team
a good functioning blood bank is also
Okay.
essential for treating aortic
For this.
conditions.
and we have all of that
Yes.
in place. Wonderful. I just want to wish you, the very best. I hope you do more cases like this and we save more lives. It's just wonderful to know this. But the next question I would like to ask you is, in this day and age of science and technology, with all of this technology improving so rapidly, you have AI, robotics, etc., and then you have minimally invasive surgery. What do you think is the future of cardiothoracic surgery in the country, in the world, say in the next 10 years?
See, what I say is the future will be still now when we ask someone to get a bypass surgery done or
Yeah.
maybe a cardiac surgery done, open heart, whatever it is, people are a little bit scared.
Yeah, open heart surgery, people are very scared. Yeah,
Open,
yeah.
whatever it is, bypass,
Yes,
open heart, whatever
yes,
it is,
yes.
people are a little bit scared, right? But I always tell them one thing, for cardiac surgery, it is or for any cardiac conditions, the risk of living with the disease is less than the risk of the procedure.
Oh,
Yes,
wow.
because
Okay.
why I'm coming to it, heart diseases is the most common reason for sudden natural death. You
Yes.
talk to a person today,
Yes.
tomorrow morning you'll find that the person is no more.
Correct.
He must be having a heart attack or a aortic stenosis or certain arrhythmias, right?
Yes.
So 75 to 80% of sudden natural death is due to a heart condition. So when a person says, I just have some discomfort after food and it's mostly due to gas, and he has been diagnosed of a critical left main disease, critical blockage in the coronary arteries, after 2 days he may not be there.
Correct.
Okay, so what has the technology done to the cardiac condition or diagnose surgery as such? It will make the diagnosis more quick, and surgical time will come down drastically, and the recovery time will come down even more.
Okay. Right.
So when the recovery time comes down more and you see a person undergoing a bypass surgery, next door is running and playing football,
Yes.
someone in your relative needs to have a bypass surgery, they will also not have any reservations in undergoing that procedure.
That's very true. That's true. I've seen in the family, somebody has had a successful bypass surgery and somebody who had been delaying it for a while
Exactly.
goes in next.
So, with this technology, the diagnosis, we can be very that's what I told you, because when we are taking a dissection patient in the OT, we have everything chopped out so that the radiologist gives us a complete picture.
Hmm.
This is the aorta, this is the tear, this is it.
Yeah.
Go and do this XYZ.
Yes.
Done.
Right.
So, the diagnosis will be easy.
Hmm.
If the diagnosis is easy and precise, it will be easy for us. The time taken in the OT will be less.
Right.
The amount of cut that we do will come down drastically, and that will lead to quicker recovery, easy life,
Okay.
and the chances of getting you treated,
Yes.
getting others treated by
Yes.
seeing them will be more.
Correct. I get it. I don't know how many of us have watched Grey's Anatomy, but all of this that you say, seems straight out of it.
Yes.
A team of very expert doctors, radiologists, great infrastructure, and everything in place.
And we must say the technicians and the nurses.
Yes, absolutely.
They form the backbone, because when we are sleeping, they are awake to keep our patients,
Yes.
running. With the OT
True.
nurses, they have everything ready when
Yes.
we are starting at 8
Yeah.
o'clock in the morning.
Hmm.
Everything ready, precise. There's a huge
Right.
background work that goes on.
Yes,
In the meantime,
absolutely.
so everyone,
Hmm.
technicians, nurses, GDAs,
Yes.
doctors, anesthetists, radiologists, the whole
Absolutely.
team has to work in unison
Yes.
to give this result, along with this AI and newer technology.
Correct. So, precision in a very tense environment, delivered with a smile and ease. Yeah,
The smile is very important
it's very
to reduce
important.
the tension.
True. I spoke to you about so many things, but the most important thing that here I want to talk to you about is your specialty. You specialize in advanced procedures like total arterial CABG, minimally invasive CABG, and complex valve replacements. How have these newer techniques changed? And basically, just tell us more about all of these,
See,
please.
changed means what? With the various types. Suppose you say, I'm just telling you, total arterial bypass surgery, right? Where, what is bypass surgery? There is a blockage out here, and we tend to create newer routes of blood supply to the heart.
Correct.
Right? So the routes, the conduits that we say, the rasta jo bana raha hai na,
बिल्कुल.
वो किससे बना रहा है?
हाँ.
That can be with the veins,
Hmm.
that can be with the arteries.
Correct.
Right?
Correct.
Now, there are veins are commonly used. Arteries require certain expertise and training.
Okay.
But, if we can use arteries in properly selected patients, then the longevity of the bypass surgery is much more.
Okay.
The arteries don't tend to get reblocked again. Right?
Okay.
So, with this technology coming in, with this technique and the expertise coming in, we can egg bypass surgery. If we suppose a person diagnosed at 40-45 years old, we do a total arterial CBG. That one procedure serves him the whole life. Yes, for the next 30-35 years.
Okay.
Right? So, that is why what we say, and he definitely requires certain lifestyle changes and all. He cannot keep smoking and thinks that his bypass surgery will go on. He just stops medicines and it will go on. No,
Definitely.
there are 2 or 3 medicines that they have to take. They have to go in for a yearly follow-up. Stop addiction, enjoy life. There can be many other things other than addiction to enjoy your life.
Yes.
And that one surgery can serve him the life.
Correct.
So this is what the newer complex procedures have done, is they have increased the longevity of patients, got them back to work quicker than before. Previously, a bypass surgery means 6 months of work.
Yeah.
Now 30 days. If we are doing MICS, 15 to 20 days. We are doing open heart, it's open technique.
Yeah.
Both are open techniques, means we are the conventional way, then it is 35 to 40 days.
Okay.
They get back and do everything.
All right. So you mean after 30 days or 40-45 days, I get back to everything?
Everything.
Including, say,
Including
exercising,
everything. Exercising, gymming,
traveling,
biking, whatever.
Oh.
If someone is a pilot,
Yeah.
then he can again go back flying planes.
Oh, that's wonderful. Okay.
So, flying plane with a heart condition is much more dangerous. You don't know when the heart attack will come.
Yes,
I told you what happened,
Yes.
right, at the beginning.
Yes.
But with a treated heart condition, you can fly the plane in a similar way.
Wow. Okay. Yeah, I get it. So I think, there is disease, but there's prevention, and then there is cure. It's all about, one, starting early, from what I've understood, and seeking help at the right time, And then, of course, like you said, manpower, infrastructure, you said something, that,
Yes.
everything in place, delivering the particular treatment. So I think, uh, you know, you beautifully explained the, entire sphere of cardiac and vascular diseases, what causes them, and what one can expect and, try and do about it. So I think with this, we come to the end of this podcast here. And I'd love to thank you, Dr. Sujoy Chatterjee, for being here with us, giving us your valuable time. I know, you just ended a very long surgery with your team and you rushed here to be with us. So thank you so much for being here and for educating our audience. I'm sure this is going to be of immense help to all of them there. It's been of immense help to me. I'm a doctor myself, but you've made things so much clearer today to me. So I'm sure it's going to help our audiences a lot too.
Thank you
Thank
so
you
much.
so much. Yeah.
Thank you so much, Manipal Hospitals, for tolerating me for the last 3 years that I've been here with them. And it has been a wonderful journey. With all of you together, we have done various cases successfully, saved a lot of lives, and we will surely keep doing that.
Absolutely.
And
absolutely.
I try to get this down to a normal colloquial language so that it is understandable by various people.
Akdam, please.
And if it helps even a 1 or 2 person, I think the whole podcast will be we will get our money's worth, right?
Absolutely. That's the entire intention
Absolutely.
behind this. So thank you once again. It was
Thank you.
wonderful to have you here. And I wish you all the more success in your life. And I wish more patients get treated by your hands.
By our hands, right?
Absolutely.
Manipal Hospitals, Sujoy Chatterjee and his team.
Absolutely. And yes, just wishing you a wonderful life.
Thank you.
you.